Good morning, ladies and gentlemen. Thank you for allowing me the opportunity to speak with you today. I'm very sorry I can't be there in person. I'd like to formally thank our host, the Cancer Council of Western Australia, and everyone who has travelled to Perth today, with a special thanks to our international guests. The Oceania Tobacco Control Conference is a key event for health advocates, researchers and practitioners in our region and beyond. Experts from a range of fields are coming together over the coming days to share achievements and aspirations in preventing the harmful use of tobacco. We all know that tobacco smoking is one of the leading causes of preventable death and disease worldwide, and I'm pleased to say that Australia is a world leader in efforts to reduce tobacco use. But we still have a way to go. Each year, smoking kills an estimated 15,000 Australians and costs Australia an average of $31.5 billion in social, health and economic costs. Alarmingly, tobacco smoking is also responsible for around 1 in 5 deaths among Aboriginal and Torres Strait Islander peoples and 12% of the total burden of disease and injury for this population group. In 2010, tobacco smoking was also the third highest contributing risk factor for disease in Australia, responsible for 8.3% of the total burden of disease, 6.3% for women and 9.9% for men. It is clear that this is one of the most important health issues facing Australia. Like all of you here today, the Australian Government and state and territory governments are committed to reducing smoking rates. We are committed to reducing the adult daily smoking rate to 10% by 2018 and halving the Aboriginal and Torres Strait Islander adult daily smoking rate in the same period. While this presents a challenge, we are heading in the right direction. I'm pleased to have the opportunity to share with you some of what we have learnt and some significant achievements. The Australian Government has put in place a broad range of strategies to reduce smoking prevalence. Our sustained and multi-layered approach to tobacco control over several decades at the national, state and territory levels is resulting in significant declines in national smoking rates. In 2006, the first graphic health warnings were introduced in Australia. And, as you would be aware, Australia was the first country to implement tobacco plain packaging. This reduces the attractiveness and appeal of tobacco products, increases the prominence and effectiveness of health warnings, and reduces the ability to mislead consumers about the harmful effects of smoking. We also know that raising the price of tobacco products reduces cigarette consumption and helps people to try and quit. In addition to these measures, a number of other complementary initiatives have made a significant difference to the national smoking prevalence, such as reducing the duty-free allowance of tobacco products, listing nicotine replacement therapies on the Pharmaceutical Benefits Scheme, extending listings for smoking cessation support, committing $155 million over 4 years to support Aboriginal and Torres Strait Islander communities to reduce smoking rates, and introducing legislation restricting Australian internet advertising of tobacco products to bring these into line with other points of sale. It doesn't end there. We've made significant investments in mass media campaigns and public education programs, including advertising and smartphone applications, to raise awareness and educate Australians about the health impacts of smoking. Importantly, Australia is also a strong supporter of the World Health Organisation's Framework Convention on Tobacco Control. I am proud to say Australia has led the world in many of these measures to prevent smoking. As you discuss your achievements and aspirations and learn about new advances, projects and initiatives in tobacco control during this conference, know that you are assisting our region in reducing preventable death and disease. I would like to thank you all for the work you do in this field, and I look forward to hearing the results of your discussions over the next 3 days. I wish you all a very productive and successful conference. Thank you.